Hi, my name is Kumar Dharmarajan. I'm a physician, I'm a geriatrician and cardiologist, and I'm Clover's Chief Scientific Officer. I'm a user of Clover Assistant, which is our tool that our doctors use when caring for Clover members at the point of care to improve care and outcomes. It's also a tool that's meant to make the lives of doctors easier. We get that doctors have to wade through a large volume of information every day, especially with new patients. Our job, we believe, is to surface the right information to doctors, learn from what you have to tell us about your patient, and together collaboratively do what you want to do, which is improve the care and outcomes of your patient. So what I'm going to do is I'm going to share my screen. This is the landing page for Clover Assistant. And what I'm going to do is launch a Clover Assistant visit, much in the way that you would launch it or your office staff would. So you just click on Prepare for a Visit. You put in today's date or the date of service. We're going to make this a telehealth video visit. I'll be the provider. I'm going to put an ID for a patient, patient's date of birth, so 2 identifiers. And the important thing is you don't have to be the one doing it. When I do this with my own patients, I have our office staff do it, and they load these visits for me. So it's not something you have to do while you're seeing a patient. So it's going to load the visit. And the important thing is, while you see this circle happening here, it's not just loading the computer program, it's actually querying data from our data warehouse to make sure that the information presented is the most updated information. So we're going to start from top to bottom. And the important thing to note is, generally this takes about 3 to 5 minutes, and actually much closer to 3. We've timed this with tens of thousands of interactions on Clover Assistant with our provider network to date. It's going to take a little bit longer now because I'm just going to walk you through things, but just know when you're doing this with a patient, it's much closer to 3 minutes than 10 minutes we're going to take. So we'll go top to bottom. So first thing is, we knew that with COVID, many of our doctors who were seeing our members were not able to go into their office. Some of them told us they didn't have records with them. They didn't have access to their EMR for whatever reason. And we said, no problem. So Clover Assistant essentially allows you to document your full patient encounter, have that count from a Medicare billing perspective, and allow you essentially to get paid for the visit, even if you don't have access to your EHR. You can document in your EHR, and you can say, I am documenting in my EHR there, or you can just put in your SOAP note right here. Real easy. COVID-19. What we wanted to do as a health plan was understand which one of our members had a definite or probable or possible COVID infection, because we as a health plan are able to reach out to those members to give them additional services to help tide them through that episode. So you can note here whether your patient is having COVID-like symptoms. And you can also note here whether you would be doing things that might be important for the member in the setting of COVID, like converting all the members' medications to prescription home delivery, as opposed to having your member go out of the home to receive his or her medication. So you could say yes, and it will tell you what is the lowest cost option for your patient, CVS Caremark. And there are different ways. You could e-prescribe to CVS Caremark, you could fax to them in this example. So it'll give you exactly the information you need to do mail order and do it at the lowest price, which your patient, I'm sure, will appreciate. Diagnoses. The important thing here from a conceptual basis is we want to get information from our doctors. You know your patients best. You know information in many cases that the health plan doesn't know. So what we want to do is understand from you what you think is going on from a clinical condition perspective, but we'll give you our information in cases where you may or may not know that a specific condition is present in your patient. So let's say you're seeing a patient for the first time. Patient may or may not have diabetes. So here, we'll let you know, hey, diabetes type 2 with diabetic neuropathy was diagnosed by Dr. McPherson in 2018. Diabetes with an ulcer was diagnosed in 2017. The patient is taking metformin. The patient has had a lab test related to diabetes with the glucose value of 244. So right away from this, you could say, yeah, probably the patient does have type 2 diabetes with hyperglycemia, peripheral neuropathy, and a history of a skin ulcer. And then you can note, you can confirm that they have diabetes and say, you know, I'm going to treat it with the medications prescribed, you know, metformin, something besides that. So literally what we're doing is giving you information that can help you understand, if you don't already, what may be present in a patient. And you can save the diagnosis. Another example of COPD. this is an example where we're saying COPD was diagnosed in 2017 by Dr. Sanchez. You might say, hey, I don't agree with that diagnosis, or it may be present, but I'm not sure. So you might say, I'm not able to confirm that, and I need additional medical records to know that better. And so what Clover will do is note that, and we'll be in a position to actually send you additional medical information on the patient that you may not already have access to. And the hope is that that additional information will broaden your knowledge of the patient. You still will, be in the position to say, hey, does this person have COPD or not? But if the person does, based on your judgment after receiving more data, we'd hope that your care plan would incorporate treatment for that condition. Here it says mental health condition. And we'll tell you, hey, we have evidence of major depressive disorder, a single episode now in remission, diagnosed in 2018, as well as a prescription for sertraline in 2018 as well. And you may say, based on that, yeah, I think the patient does have major depressive disorder. But what it will do is it will lead you through a pathway where it'll give you more prompts to help you better categorize that condition. Is it depression that exists now? How severe is that depression? Is it recurrent? Is it resolved? So we'll say in the past month, has the patient dealt with major stressors? Because that could be an adjustment reaction. You might say no. Has the patient had depression in the past? Yes. And how severe was it? In your opinion, you may say it's moderate. And that's very helpful to us to help think through other resources we could deliver as a health plan to help you care for the patient. And you'd confirm that, and you're saying maybe treat with sertraline and other medications. And one other example of secondary hyperparathyroidism of renal origin. So it'll say the patient has chronic kidney disease, right, based on our data. But because of that, there's often secondary PTH, hyperpara, that develops. And then it'll say, secondary hyperparathyroidism of renal origin. And it'll ask you, is that condition present or not? And you might say, I don't know if it's present. I'm going to need a PTH to be ordered. And you'll say a lab result is needed. And in that same way as on the above example, where we can give you evidence to COPD, we'll be in a position to send you data that might be relevant to the secondary hyperparathyroidism diagnosis. On the med side, it'll give you a sense of all the meds that Clover has evidence that the patient is currently taking. So in this case, glimepiride for the diabetes. And it'll tell you, hey, this patient is on a 30-day prescription for diabetes. We found that if you convert to a 100-day fill, they're more likely to take their medication. Are you interested in doing that? And you can say yes or no. If you say yes, you just save it. Gaps in care, colorectal cancer screening. So in many cases, the right thing for certain patients of yours is to do a colonoscopy, let's say every 10 years. So has this patient had a colonoscopy within the past 10 years? And in some cases, your patients are going to say no. So you'll say it is appropriate, but the patient said no, and the patient has refused colonoscopy. Well, then Clover will say, will you send the patient a FIT kit as a stool assay? And you can say, yeah, I will do it. But if you don't have a FIT kit in your office, you can just say, hey, I want Clover to send my patient a FIT kit. You click that, you hit save task, and a FIT kit will be in the mail to your patient. In clinical recommendations, there are a number of recommendations that could be present based on a patient's condition. So we'll just look at one. So given the diabetes, given this patient's diagnosis of diabetes that you confirmed, their age or 40 or over, so let's assume this patient's 40 or over, it'll say, hey, they should probably be on a statin, but it'll give you not just the information that they should be on a statin at moderate intensity, and they'll give you the dose. It'll let you know how much these different statins cost your patient, which is critical in maintaining medication adherence. Obviously, all else being equal, your patients will probably want the medications that are less expensive. And so let's say you're going to prescribe a medication based on that and share a task. And there's a ton of different clinical recommendations. We're not going to have time to go through them, but for conditions like diabetes, coronary disease, CKD, and a number of other conditions are being built out. And this last one is supportive services. So as a doctor, if your patients have limited life expectancy. We know that the research in general says that doctors are very good at determining whether their members are expected to live 6, 12 months or less. So we asked the question, would you be surprised if your patient were to die in the next 6 to 12 months? If the answer is yes, I would be surprised, you're done. But if the answer is no, I wouldn't be surprised, Clover lets you know that we'll offer your patient enhanced supportive services for free. We're very happy to talk to your patient about, resources, end of life planning, and other considerations that may be important to him or her, and help you and your patient execute on a care plan that's consistent with your patient's values and preferences. All right, and once you're done, all you do is electronically sign and save, and you're done. And I know here, we took a number of minutes to go through this, but the key point here is that in practice, it only takes 3 to 5 minutes. Part of the goal in this conversation was to be really thorough and walk you through a number of examples. I run practices that use Clover Assistants thousands of times every week. And for us, it's just a part and parcel of every visit. And we believe that it allows us to drive better care for our members. It's easy to use. We use it at the point of care. And the really exciting thing to me as a clinician, but also as a Clover executive, is that we're really at our infancy when it comes to Clover Assistant. It's getting better and better all the time. So not only is it a tool that we think already can help drive better care and outcomes for patients, it's something that's constantly getting better. We're putting in new and new information into it, more features that doctors want. Before we go live with anything, we talk to doctors about it, we vet it, and we really just want to make your ability to provide care for your patients easier, more effective. And thank you for listening to this video.